have more policy discussions, more initiatives around implementation of practices that break equity as part of our decision making, and deeper understanding from our boards or our governing bodies, and then into all the way to staff and training for staff, and then implementation and families that serve. So finding out a way to go about doing that well would be I think a big priority over the next 2 to 3 years. I'll stop on that question.
Great.
For my note taking, is it you broke up a little bit, George, so I want to make sure that on the second point, that to summarize that on the to lift up more anti-racism conversation and bring a bigger or deeper understanding at every level, and then bring that into training to address the anti-racism needs.
Yeah, and I would use words that we, whether it's bias or unconscious bias, and us understanding. I think we just need to understand practices that take place, systems that are articulating themselves, that have created systemic inequality, understanding anti-racism, understanding equity, understanding how we do things that limit access and opportunity, or high quality programs or high quality deliverables for people. I just think that in general we need to get really strong at that as a system. But I do definitely think, like in schools, for sure in schools, our boards needs to get strong, our executive teams need to get strong, our administrators need to get strong, and then our teachers need to get strong, and then our children and our families need to get strong. But there should be a process that we follow in that. And I think depending on the region or depending on your lived life experience, there's just a lot to unpack. And I think people need to get really good at being uncomfortable with these kinds of conversations and moving towards a direction that creates a compelling future. And I think that we just need to have people out there that can help us process that and help organizations process that. One thing that I think that I heard that Mrs. Salazar said was that they hired kind of at their system cabinet level an equity officer, or a person that was kind of the professional development trainer that was doing more equity lens decision making for all the things that they're doing with housing funding. And that's not what every school district has, and that's not what many school districts have. And I'll just say that there's things that we need to get better at for our state, and I would be interested in having policy or initiatives or laws or directives that help us move in that direction, or force us to move in that direction, even if it's out of compliance at first. I think over time we can get to commitment.
Thanks.
Who wants to go next?
I'll go, I guess. I guess my points are, I'm assuming we're not just talking about the equity lens and the COVID area. I want to expand a little bit beyond that. So I think that Sue shared my column that I did a couple of weekends ago.
Excellent, Katie. Thank you.
Yeah, you've heard me say this before, at how incredibly upside down the economics of childcare are. It is so very broken. And I'm looking at this, and we're going to be coming out of COVID with probably optimistically half the amount of childcare we had before we went in. And they're so susceptible. And the people who work in this industry are so susceptible that we really should be taking this opportunity to change the whole formula. and look at micro centers, shared services, subsidies, whatever it is that we need to do, make the economics actually work out so people can afford to put their kids in childcare. Folks who run childcare centers don't work themselves into the ground, make minimum wage and still can't make it. And I just think that it is the absolute perfect time, if there was a silver lining here, to start over. And how do we do this in a manner that's efficient, that is the level of quality we want, but with a creativity level that we have, frankly, I think lacked. There's so much subscription in space, and now dealing with the COVID stuff. I'm not advocating in any way that we do something unsafe or that isn't good for kids. I'm just saying we got to be a little more flexible. And I don't know what I mean by that yet, but at the very least, what can the state do to enable some models and some pilots that actually make some economic sense and achieve our goals of high quality, equity, and accessibility? And I just think that throwing money at providers right now is going to keep the doors open a few more days, and then that's it, because of the limitations that we have to deal with to keep everybody safe. So if we don't do something about it right now, shame on us.
Thank you. I know I'm facilitating, but I will just add an editorial comment. I think this is the first moment in my professional career where I've seen childcare recognized so broadly as part of the essential economic infrastructure of the society. So I think there's at least a beginning of a recognition of the role that childcare is playing. So I think at least an opening for this conversation on how do we think about an actual childcare system that has some basic economic logic to it. So anyways, I will go back to my facilitating call.
Hear, hear.
Eva, Anne, do you want to jump in?
Go ahead, Eva.
Thanks. So yes to all that George and Katie have said so far. And I think a little bit to a specific suggestion, and I think that this is where the Healthy Kids Council that the governor's putting together may have come from me suggesting this, but I think to help sustain the childcare workforce and to help meet the needs in the moment of families and children in working through our distance learning or however school is going to work in the fall, that we really need to figure out how do we really build on the existing childcare workforce that we have and quickly get others up and running to meet the need of the bigger childcare needs, especially if children aren't in school a full day every day, you know, if they're doing distance learning. And how do we connect those childcare and have smaller cohorts that match the, like if there's a hybrid of, you know, the kids are in school, you know, half day on Monday and Wednesday, that cohort is at least part of that same group that's together on Monday and Wednesday, so that we're not mixing, you know, like we're not increasing risk of exposure. So it's going to be a delicate dance, but I think it's important for numerous reasons. As David just pointed out, we have the recognition that childcare is essential to economic stability, and is so important for families to be able to work, and that we need to have a and to Katie's point, we need to have a well cared for and economically stable childcare system. And we need parents to be able to work. They can't, I say we because I'm included in this. We can't continue to work and provide for our children in a way that is necessary for all of us, and be their school teachers as well. And then, for the families who have, that also have school as their safety net for ensuring their kid has a place to go during the day and has access to 1 to 2 meals a day, if not additionally snacks too. How do we build a system that is maybe inclusive of childcare providers in that, so that maybe we're not just saying you have to be working full time to be able to access childcare, but we're also meeting support needs of families. Again, I don't know exactly what it looks like, kind of like, Katie, you just said we need to be flexible, but what does flexibility look like right now? But I think our childcare community and our families have lots of ideas that we could quickly figure out if we had the right people at the table to do that. So that's more of an immediate, but I think it'll have a long-term impact on, continuing to build our workforce and providing stability in that too.
Okay, I guess it's my turn. Hi, this is Anne. I just want to say ditto to things that have gone before us, what everybody has said before. I do think the childcare issue is just absolutely premier critical, and I appreciate Katie saying that maybe this is a moment to sort of rethink the entire system. I hope that's the case. In rural Oregon, we just have so few institutional resources and to be able to provide the childcare, and no flexibility whatsoever. I mean, I think whatever we're saying about what's wrong with the economics of childcare, the capacities, the space limitations, transportation limitations are only just exacerbated in rural areas, and none of our workers can go back to work without childcare. They just can't. And I think the point that Eva was just making about yes, it's early learning, but I wonder the questions that people are having is also what's going to happen to their K-6 kids who are not going to be supervised, who are going to need to be supervised if they're not going back to school. And can there be a more seamless way of thinking about that? I don't know, but that's where the flexibility that Katie and Eva are talking about might make a big difference. But it is a major crisis for everybody in rural Oregon, as well as I'm sure in urban Oregon. The other thing that we have not talked about in terms of content has to do with behavioral health, child abuse, and the family supports there. I mean, we live in a part of the state where the reports of child abuse and neglect were going up, basically almost doubling every year for the last few years. And the fact that the reports of child abuse and neglect have declined by 70% is just horrific to us, because we know that those parents are at home and feeling really stressed and having not the support that they need. Maybe the innovations that have come up that actually Pat Allen was pointing to about virtual connections between family support organizations, workers, et cetera, whether it's home visitors or other kinds of parenting education and relief nursery folks. Maybe the creation of virtual ways of doing that is something that can stick with us for a while. Again, if we're talking about rural areas, that's still really hard. But I think we are terrified about what's happening with kids in their homes right now with highly stressed parents, and what's going to happen when we reopen, if we reopen, how are we going to handle all of what the teachers or the other mandatory reporters start to see again. It's really scary.
I hope you don't mind if I ask just a follow-up question, because you know, I think one of the things I've been hearing a little bit about is that where broadband access had always been sort of an equity issue, particularly for rural communities, it's now also a healthcare issue and a family support issue. So just wanted to see if that's also something that's coming up in your work with rural communities.
Absolutely, and it's really the education thing really kicked it all off, trying to figure out how parents can be educating their kids from home when they don't have access to any kind of broadband. It has been huge. And you know what, like we had this story of there's a story that we heard about just last week or the week before of a parent who has 3 kids. This is just outside of Coquille. Parent who has 3 kids, I think like 1st grade, 4th grade, and 7th grade or something like that. And she was driving every day to a place where the school bus was, sitting in a parking lot where the school bus was with its mobile hotspot on the school bus for 4 hours every day to try and help her kids, who had only actually 2 Chromebooks, it turned out, with 3 kids in the backseat of her car, trying to figure out how to have her kids be able to do what they needed to do in school. Now, just think about that. That is a totally motivated parent who was at her wit's end trying to figure out how she was going to do that, to drive to where the mobile hotspot was in the bus. Can you imagine the parents who are not that motivated and who can't and who don't have that resources? But so I think the education piece has really raised up the need for broadband in a way that it's not just a generic equity issue in the way that you were talking about it anymore, David. It is parents, all households are feeling it very directly because of their kids and kids' education. And maybe that will trigger something new that will also have spillover effects for child abuse prevention and intervention and so on. But I think the education piece has really been the trigger, that at least that we feel.
That was really helpful.
Yeah, I would just say, I was going to echo, yes, because working with behavioral health people too, they've all noted that broadband issue is more than education, that it is healthcare too. And then, and you also asked, or you pointed that you are hearing questions from parents about K-6 needs, when school goes back, and it's happening right now too, with fewer camps happening.
Yeah.
There are less opportunities, but our licensed in-home providers, many of them don't just cater to the 0 to 5 age. They also provide school age care. So that, many licensed in-home providers care for entire families. So they'll have the little ones there all day, and then the school age kids usually before or after school, if not both. But I think they're easily prepared to be able to take on this kind of role. And the FFN or regulated subsidy would also be included in that. And I think that there are probably a lot of them that are providing care that we don't know about too. So how do we get them involved and get them ready to take on a bigger task?
Yep.
And how do we do this with some agility? And I say that because you look at some of the components that are going around, and I appreciate what you're saying about access to Wi-Fi. I understand that some folks in the Bend School District, Bend La Pine, We're driving around school buses with Wi-Fi in them and
Yeah.
driving them into neighborhoods during certain times of the day. So parents and kids could work during on schoolwork. And that to me is just ultimate. That's like on the ground, get it done, get it out there, kind of a reaction. And with childcare, here's some of the things that I'm hearing from the field. So commercial realtors, folks that lease and buy commercial properties, nobody is signing any deals with any leases with childcare anymore. They put it off because they know that the confines of the limitation of how many kids you can take, the increased risk, the fact that so many of these childcare providers could not get EIDL or PPP access because their numbers are upside down. The banks wouldn't bankroll it because they couldn't take the risk. And so there's a moratorium that is not official, but it is very clear that's out there. Nobody is doing commercial leases to childcare right now, period. So if we do something with some agility and flexibility, here's what it might look like. It might look like, let's say, the state putting in X amount of money to stand up a few pilots across urban and rural Oregon in microcenters, where you pick a champion childcare provider who has a network established, so they can put together a group of providers they can deploy. They can staff it. They understand what we mean by quality. We can help them aggregate their food, access to accounting services, all the things that go into actual business operations, and then find a bunch of volunteers, either commercial and or community spaces, that say, yep, I'm up for being on pilot. And that's what we're doing right now. We are identifying folks on the ground who say, yeah, I'm willing to try this, including our local community college. So you find the space, you find somebody who can coordinate the providers and actually run these centers and give them a little bit of boost, money, expertise, whatever that looks like, to support the infrastructure. And then maybe, I know this is a tough one, it's all tough, but there's got to be, in this equation is liability.
Yeah.
Is what has kept people from trying. Even the community college says, we'd love to host this, but somebody else has to run it and assume the liability. What can we do as a state to backstop that? And make it more feasible? And let's just try it. And that model, or a similar model that we can track and keep data on, and how quickly did we get it up and running? How well did it run? What was the cost savings? What worked, what didn't work? And maybe we can multiply it. Let's start with a handful and do it as a state-run pilot and see what happens.
Eva, can I?
Oh, go ahead.
I'm sorry, Katie. I'm sorry, I meant Katie. Can I just ask you, so when you say, you use the word volunteers, who do you mean by volunteers in this? Did you mean for the space, or did you mean?
Yes,
for
people
more?
who want to step up and say, hey, let's do this in my space, because we have like Hydro Flask. You guys know what Hydro Flask is, right? Their headquarters is here. They've had a child care issue for years, and they approached us and said, hey, we actually have a room in the back. Can we use that for a micro center? COCC, Central Oregon Community College, one of the biggest colleges in the state. Hey, we have some rooms in the library we're not using. Can we start it here? St. Charles Hospital has space off campus. There are other folks in the business community who are saying, hey, I can do this. But if you're in a commercial lease, and even if you're not, if you're what I mean by volunteering, saying, yes, we're willing to step up and try a pilot, you still have to deal with the liability issue.
Yeah.
And somebody else has to run it.
George, I just wanted to check in with you, because I know sometimes being on the phone, it's hard to jump in. Just wanted to see if there was anything you wanted to add to this part of the conversation.
10 more minutes, like 15 more minutes.
I don't know if you can hear me, but I've enjoyed listening and hearing every perspective. So I don't think I would add anything I definitely agree that the Wi-Fi and families, making sure that we have enough support during this time and alignment with the school district and healthcare and childcare providers is something that we got to also look out for. So I agree with that, those comments.
Thank you.
On the, I was going to point out on, Katie, I like what you were saying about flexibility and agility, and I think you have it's kind of a center-based perspective that you're sharing, and I think that we have the certified in-home childcare providers too that have a little bit more agility and flexibility. They're currently able to take more kids if they have the staffing to be able to split them into, two groups of, once they hit the 10 kids range, they can split the kids into two groups that are stable cohorts. So they have a little bit of flexibility, but to kind of go off of what your idea was too, when we were first talking about shutting down, a couple of the providers that I know, including, some of they were talking about, is there a way that we could continue to have parents paying the childcare, right? But they send the kids into smaller group settings, stable group settings, where a family hosts, kind of like a nanny share, but you're working through your existing childcare provider, because that way, if you had a family that had a school-aged kid, they would be included in this cohort with the younger kids and have somebody to help look after everybody, instead of having families trying to struggle with where they're putting kids. One of the things that came up as yeah, that's a good idea, but was insurance and liability around how do you have employees of a place working in a different space that isn't covered by the business insurance. And of course, there are all the licensing issues too, because our in-home and our center-based care providers all go through really in-depth inspections to be able to provide care safely. So would we require that same level of inspection and rule following for the families that would host, the smaller groups of childcare, as if, what happens, this happens all the time in nanny share situations, but they don't have to follow those sorts of regulations. So what would we be willing to, I don't want to say, of course, there are always safety protocols that need to be considered, but where's the flexibility and agility to be able to address this need in this moment, to be able to keep the childcare providers working, the childcare and their staff working? How do we address, the main, that there's still a need, but we can only do it in smaller groups. So yeah, and I think, in-home or hybrid of various things is definitely what's needed. And, what are insurers willing to help cover and not increase costs exorbitantly as well?
I just want to do a quick time check. We're about halfway through our time, actually a little bit more. Have 2 more questions to go through.
Mm-hmm.
Thought maybe if it's an okay transition moment to also move on to the second 2 questions, which I think actually are pretty related to each other. What are your funding priorities for the next year and by 2023? And then the third and final question, what are your key recommendations that the council should share with the governor for the next year when you have a chance to speak directly to Alyssa at 3? Want to kick us off?
What's your Would you like me to go first?
Sure.
I guess I'll state that I think it's back to those original comments of whatever is aligned to Raise Up Oregon that we really need to accomplish. I still want us to keep funding close to that. I do think the idea of quality and making sure that we can support the workforce or bring in more people into the workforce needs to be that. If there is anything around this pandemic time period that we need to align and adjust to, then I think we have to have money set aside for that. I'm in that phase of how do we help families? How do we help parents? How do we help people at home so that their child can thrive in this time period? And what are the programs, or what are the activities? What are the things that we can do to support literacy or numeracy or behavior at home, and to have families have that capacity to improve or to support their children better at home, and then anything that, as it relates to funding that we can do for system development that incorporates anti-racism, bias, and equity. Those are the things that, I guess, whether it's funding or whether it's priorities, I'm going to just keep saying I think those things we got to improve, and if we can partner or create kind of more opportunities for people to help with childcare, to support childcare, that should be there. One interesting thing that I keep hearing just on insurance companies or insurance providers is that even for school districts or in many businesses and organizations, they're moving away from covering contagious diseases. So a lot of businesses and healthcare or school districts, folks that do this kind of work that are going to be working with the public aren't going to be covered and for any risk or exposure of liability of people getting COVID during this time. So it's just something that gets in the way of doing more. That's my point. I'll stop.
So my thoughts on funding priorities, it's just going to be hard. It's going to be tough the next 2-3 years. And it's why I think that it's going to be a blend of trying to stand up programs that achieve what George is talking about. And I also think that there's got to be some room, a little bit of room to experiment, because I just, in times like this, when you deploy state funds, and I say this with all the love in my heart that I express, that the bureaucracy of the state weighs it down a lot. And getting the money out, trying to appease absolutely everything, and then doing a task force, and then a legislative decision, and then the administrative part, and then a lot of departments, and I understand everybody's trying to streamline it. But I think there needs to be a little bit more tolerance of risk of trying things that are new with funds, and do the best we can to achieve the things in equity and access and just the level of quality that we've all talked about for a long time in what it is that we want to achieve, but to do it in a way where we think it can be deployed efficiently, because we're going to have to get really creative. And how do we do that and keep ourselves whole of what we want to achieve? I don't have the answer, but I'll tell you, it's got to go faster than it's done. I'm just telling you this. I have been the one, as well as some other folks in the hubs, and I'm sure you guys have gotten the calls too. I'm going out of business. I can't stay in business. I can't find childcare. I can't get my best employee back because they got to work from home and I need them at work. I think the business sector is going to be forced to be super flexible here for a long time on this life, family balance, work balance. But I think that funding needs to be about, in part, we need to be able to shave some off to say, let's be creative and let's try something different and let's see if we can't deploy this thing on an efficient time scale. And so that we're not hanging up the good in pursuit of the perfect.
As you were speaking, Katie, it was reminding me of a conversation I had with a colleague of mine in the health sector. And I think she was actually more talking about funding of rural hospitals, but she was saying we had a broken funding system. It's been completely demolished. Why would we rebuild that broken funding system rather than thinking about actually having to build a funding system that actually works?
Yep, that's right. This is what I'm saying is can we just start over? And without having to start over, I think all the work that's been done, we can pursue. I just hope we get out of our own way to get it done. Spoken like a true business person, maybe. I don't know, but I'm not really. I mean, I spent 20 years in the public sector. I get the whole 360 of this, but I just think that necessity is the mother of invention, and boy, it's time to invent.
And what I heard you say, Katie, is that one of the key obstacles one of the key things that would limit our ability to invent is the fear of liability. And if we could remove that from the equation, that could break open a whole lot more creativity.
Yeah, and I think that there's also opportunity to really achieve. There are a lot of cooks in this kitchen. And let's just say an example. We assimilate all the great work that we've done, how we want to, what quality means, add the equity lens, and for example, fund someone's pilot for a year of providers across the state that we trust that get it. And say, I'm paying you this much a year to start a micro center program. I want you to open up at least a half a dozen within a year. I'm making this up, obviously. And here's a criteria you know about because you've been working with us. You know what quality means, and you know what early brain development means, and you know what we mean by an equity lens. And here's some money. We're gonna give you some guidance, but we're gonna let you go do this and do it fast. And we're going to give you a break on the liability. We're going to back you up in this way. Go forth and prosper. So it's a public-private venture, in other words. That would be one way of doing something like that. And then say, here's what we want to achieve, and we'll be helping you along the way, but not get mixed up in the nuts and bolts of it too much.
Yeah.
Just an idea.
I think that, the liability conversation, we have this specific COVID lens right now. And as to, George pointed out that the insurers aren't covering communicable or dropping communicable disease or diseases.
Can we just pause for a moment and how ridiculous that is? Just in the middle of a pandemic, and now we're not going to cover it anymore. Sorry.
Yeah.
Continue.
No. I think part of what we maybe could ask, which I know that public health, because that's the other board I sit on, is the public health advisory board for the state, but I think we need to have clear guidances and instructions about what what forms of protection people need in various settings. Like if you're in, like a one room micro center that has access to one bathroom or whatever, what layers of, like what are the things that are absolutes? Like is wearing a mask that's changed every 2 hours, or, and like how does that impact your health in other ways too? Because I think, like it's a layered complication for sure. But like what types of settings need what things, and would that make insurers feel better if employers that include childcare are checking, childcare and school are absolutely checking these boxes, knowing that there's always going to be a certain level of risk if you're not completely isolated. Yeah, what will get them to a place that's okay? Is it clearer guidances? Is it clearer guidances that are broken down by different types of areas and works, work types, or, and how do we ensure that then those various settings have access to those appropriate levels of protection? So I guess that would be a funding thing too, but that's funding for all workspaces. If we're going to if we're going to no longer pay people to stay home to avoid spread of COVID, we should be taking that money and spending it on ensuring that we keep people the safest we possibly can.
Mm-hmm.
So thinking about the money question for a minute, so we're likely to have a second special session pretty soon to rebalance the challenging budget. But we also know that there's going to be a much more difficult budget conversation starting next year. And the governor has already started the process of building her requested budget, and that's really going to happen between now and November. So what are the things that you want to, as a council, share with the governor as she and her team are building their requested budget? Or are there things just in terms of principles of priorities or specific areas that you want to make sure as the council you're asking the governor to be part of that process?
Have we developed a kind of a guideline book for childcare providers? Have we developed a resource in this time period for them to follow with healthcare, as well as systems of support that they should be working with or using? And if not, then I would say, us making sure that we have something like that. I'm sure we do. So I'm sorry if it's like something that I'm bringing up that's improper, but that's important to me, making sure that we have the health needs or health requirements of workers in mind, and children in mind, and those that come in contact, having enough safety equipment, having enough resources like that. If there is money set aside for that, for childcare locations, that would be important to me. So
Ava?
I'll stop for right now.
I would say that I think I just stick by what I've already said, David. I think that there needs to be a slice of money that goes toward funding pilots. And the pilots' criteria is maintaining quality, generally, and something that's scalable. This is what the business sector looks at on a viable approach to anything, is if you really want it to work and you want it to grow and be accessible to more folks, and it's got to have some sort of scalable approach. So I think it is a priority that if we're going to allow some flexibility at this time to really reinvent, is to try some stuff. And it needs to be something that can be deployed very quickly that achieves the things that we want and creates economic models. The outcome is something that's scalable with an economic model that makes sense. And to do it now and to have that part of the budget that they discuss next month, I think would be really great. And don't talk about it for 6 months or a year. Just do it. Go and do it. These models exist all over the country. So go identify, come up with some criteria. I know the task force is, I'm not quite sure what the outcomes of the childcare task force are. I've been a little confused over that. And, but take the best work that's been done so far by the ELC, by the Early Learning Division, and try some pilots and designate some funds for that. In the existing world, I think that we need to continue to find ways to boost these folks, because they are not going to be able to make it without some sort of financial assistance. The folks who are already out there, if we don't want to lose more, we got to figure out some cover. So how do we identify an ongoing funding stream? Hopefully it'll come from the feds to a large degree. Hold on to it. When we get it, have the criteria ready to go and get it out the door as quickly as possible.
Anne or Eva, was there anything else you wanted to add?
I was going to jump in, but Lucas was just telling me about a book he was reading. Also important. I think I also need to note, and I don't know, like, David, I know that you have heard these conversations, but we have a number of providers who, you know, aren't going to open by September, so therefore not applying for, you know, the grants, because part of the conversation is to, you know, like, or the requirement for receiving a grant is that you plan on reopening by September. And I think that, you know, if we can't just let those providers go. I mean, and you know, they're not planning on reopening, whether, you know, because they may have their own healthcare considerations to make, and it's too risky for them to open, or, you know, they have loved ones in their household that they care for, or even not directly in their household, but they're also caregivers for. So, you know, they can't reopen for those reasons. And so how do we, you know, loop them in? Do they become part of the network that supports the other providers in getting them, you know, providing the shared services kind of thing? How do we get them included so that when we do become a fully operating fully economically viable and have full capacity for people to go back to work again, and we need all the childcare settings open, that, you know, they have the financial means to be able to reopen and start providing care again. You know, so they're, you know, they've put in years and years of service. How do we just not toss them aside and forget about them? What kind of fund, how would that work for funding, I guess?
I'd like to just make sure that I bring back in the whole concern about child abuse prevention, intervention, parenting supports, and so on. I think that the stresses that we know are existing in parents, in families right now, that we surmise they're happening, are not going to, they're not just going to leave. Even if we get a vaccine and everything goes back to normal, there's going to be long-term consequences of very poor, very isolated families not having the resources that they need, living under multiple layers of stress. And if I'm looking at sort of next biennium budget priorities, it is got to be about thinking about sort of the medium-term consequences of whatever's happening now that is going to have ramifications long into the future. And the thing is that we have great home visiting. So we have so many of the elements of home visiting, parenting education, relief nurseries, etc. in this state. We have an almost investable infrastructure, almost. There's just enough out there but it's enough that I think we can, if it was a budget priority in the next biennium, we could build those out. We've got good models, we've got best practices, we've got them in paying attention to equity and cultural diversity and geographic diversity and so on. So I'm concerned that be put out there as an additional important priority going forward, because I think the legacy of what families are experiencing now will haunt us well into the future.
Oh, for sure.
Thank you.
I think that's really well said, Anne. And you know, just to elaborate on the point of really vulnerable populations that are out there, housing and food and access to healthcare and access to childcare. The folks who are earning minimum wage, it's just going to be so hard. It already is so hard for those folks, exponentially compared to others.
I'll mention another comment a colleague made to me that I think is very apropos of this discussion, which is, you know, that on the one hand, while children haven't necessarily been the population most directly impacted by the virus itself so far, we have every reason to believe that that's the population that's going to be most impacted by the secondary impacts of the current situation.
Right, exactly.
And I think that's just sort of an important thing to keep on reminding folks and put on the table, that fact.
And their impacts will have much more long-term effects.
Yeah. I mean, everything we know about brain development is telling us that those kids are experiencing trauma right now that they're going to need a lot of help to overcome.
Yeah. And different layers and different types, and yeah.
Now that we've all depressed ourselves.
I know.
Oh my gosh. It's just like, yeah.
I want to say, Katie, about the business community and childcare. I mean, I'm hearing it all over the place in where we are. And I'm wondering whether the business community is likely to step up in a new and different way. And, you know, like you were talking about spaces. I mean, one thing that we know is commercial real estate is not a business anybody wants to be in right now. There's going to be vacancies everywhere. And so the business community needs to be doing something different. So I wonder if business leadership is going to be required to get to the flexibility that you are advocating for, because for them to be functioning as businesses, they know that this is their number one priority. How do they get their employees back if they don't have decent childcare?
Yeah, and yes, I know there are a lot of businesses here that are understanding that. The issue, as always, with the business community is with the corporate activities tax. If you're talking about finances and adding tax, it's not the time. And I don't know how else to answer it.
Yeah.
You know, and that is the question, because in the long run, there probably is at some level, sedation has to happen, like we do with our schools.
Yeah.
It's the same dang thing. I just don't know how you go about doing it. And, but I do think that there is some commonality with the business sector. I've been doing a lot of advocating around a good neighbor or a good Samaritan type of policy. for the next session discussion with a lot of businesses that are talking about getting liability relief. I think that's an area that can dovetail pretty naturally in advocacy with the legislature and with the governor is, can we find a way to back off on liability? And we all know that's a political question with trial lawyers, and I won't get into it. Don't go down that rabbit hole. But they are willing to, I know that they're talking about putting a task force together right now. Our representative, Sherry Helt, I think might be in on some of those discussions. And maybe that's an area that they can start some collaboration to say, hey, and we have, oh, we're almost done. And we
Last word.
So I'll stop rambling.
So anything else someone wants to add in 42 seconds?
Well, so I'm responsible for reporting back. So I've been taking notes, and so I'll see. I think there are a few key points that we make, but when I report back, if I miss them, will you help me?
Yes.
Well, thank you guys. Appreciate that you was allowed to join this group and help facilitate. So thank you very
Thanks,
much.
David.
Thank you.
Thank you for facilitating us, David. We would have missed things had you not been here. Thank you.
So I will see you soon.
Okay, thank you.